Even the most developed countries with extensive healthcare systems were left helpless when the coronavirus first struck. With cases now past 5 million worldwide, those countries that suffered early on have started to reopen as their infections and deaths eased. But if more advanced countries were unable to contain the initial outbreak, you can imagine what damage it could do to the most vulnerable. Places like Yemen have started seeing a steady rise in coronavirus infections, a situation the WHO warns could turn catastrophic. Having suffered 5 years of war, the country's fragile health system would be unable to handle an outbreak. Most of the cases are concentrated in Yemen's temporary capital, Aden. But with a lack of testing, no one truly knows how far and wide the virus has spread. And one of the largest refugee camps in the world recently confirmed its first case of COVID-19. Having been locked down in early April to prevent a potential outbreak, the Cox Bazaar refugee camp in Bangladesh is now on high alert. Home to more than 1 million Rohingya Muslims who fled persecution in neighboring Myanmar, health officials warn that cramped conditions at the camp are a perfect breeding ground for the virus. To discuss what is being done to help the world's displaced from Dhaka, I'm joined by Stephen Corliss, who is the UN Refugee Agency's representative in Bangladesh. So, Stephen, welcome to Straight Talk. It's good to have you on the program. Tell us about what's happening in conflict-stricken and war-torn countries around the world, and how are they tackling with the coronavirus outbreak?
Well, this is the greatest level of displacement we've seen since the Second World War that we're grappling with already globally. And the coronavirus pandemic has only complicated our work. Here in Bangladesh, it's not a war-torn country, but it's a country that's hosting 860,000 Rohingya refugees. This is far smaller than the number of Syrians that Turkey is in fact hosting, but they're all living in a very small area, perhaps 20 square kilometers, and living in very fragile homes, very difficult to maintain social distancing. And of course, the demands of the pandemic are going to be tremendous for particularly healthcare. It was only a week ago that we had the first confirmed case of COVID-19 in the refugee camps, and today we're up to 21 cases. And that doesn't seem like a very large number in absolute terms, but we're definitely on the upward arc of the curve.
So how dangerous could this situation get?
Well, I think it could become very dangerous for the refugees and also the Bangladeshis living in nearby host communities. Actually, the number of cases in the host community is approaching 300. And when you hit that level, things can move very, very rapidly. The healthcare infrastructure is quite limited. At the beginning of the crisis, there were only 2 intensive care beds in the entire district, which is has a population of about 2.4 million people. And in the camp, of course, the healthcare system is quite basic. Although I would say one of the very best medical facilities that we have in the camp, and one with a surgical ward that treats 150, 500, 1,000 patients a month, is the Turkish field hospital provided by the government of Turkey. So this is really a tremendously important contribution that the people of Turkey are making to the Rohingya refugee crisis.
So on the other hand, over 300 refugees in early May floating adrift in the Bay of Bengal are now being held at an island where Cyclone Amphan has hit. Apparently, the government doesn't want to take them back to Cox Bazaar in fear of coronavirus spread. How are they holding up? Can you tell us about the extent of the damage there?
Well, I think the first thing to say is a positive thing, that the government of Bangladesh safely disembarked people from a vessel in distress at sea. UNHCR and the international community have urged the government to bring the people back to Cox's Bazaar, to the camp, where services are available, the medical care they need, but also family and community networks are available. The island itself does not seem to have sustained major damage. The major part of the storm passed to the west of Bhasanchar, the island in the Bay of Bengal. There were high winds, there was some flooding, but the people appear to be well, although we have not had access to them. This is something that's expected to happen in the coming weeks.
So tell us about the obstacles you face in delivering aid and help scale back up the measures against COVID-19. Have you been forced to, in a way, scale back your activities currently?
Yeah, we've moved with the agreement of the government of Bangladesh. We've moved to what we call critical activities only. So this is the delivery of food, nutritional support, improvement of water, sanitation, and hygiene facilities, and most importantly, communicating with the communities. Information is really the first and most important line of defense against the coronavirus. But because of the scaling back to critical activities only, we have reduced the number of people going to the camp every day by 80%. So only 20% of the people who were going there to help in the past are going there now. And what is really making the operation still function are refugee volunteers. These are the Rohingya refugees themselves who play the most important role in delivering services, communicating with the community about how to protect themselves against coronavirus, where to go to seek medical care. And that is how we are now able to work, because over the past 2.5 years, we've made refugees really the central part of our operation.
Is it true that doctors are not allowed in camps and they give visual guidance to those already on the ground? And does it help?
No, I mean, we do continue to function. Just this week, UNHCR opened what we call SARI ITCs, that's Severe Acute Respiratory Infection Isolation and Treatment Centers. We're working toward a target of 1,080 beds in the camp. This will still be far lower than we actually need to meet the needs. We could have a need for as many as 10,000 beds at the peak of the pandemic. But just yesterday, we opened a 150-bed facility, a few days ago a 50-bed facility, and by June 15th, we hope to have 1,080 beds in place for isolation and treatment. So the medical personnel are really part of that critical team. Here on your screen, you can see that center going up. It is actually open, finished, and functioning as of yesterday.
So even the most developed countries are consumed with their own COVID-19 battle. Their economies took heavy blows. To which extent the international community's aid operations have been effective in helping the poor in general?
Well, so far, we haven't seen that impact. The funding decisions have been made in the past, but also for our special appeal for COVID-19, we received quite a strong support from the donor community. But we have to be concerned about what will happen in 2021 as economies contract, as the donor governments spend quite a lot on domestic stimulus, on employment, healthcare response in their own countries. There'll be less funding available for discretionary spending and for humanitarian operations. So this is something we really have to prepare for, and also make the case that the Rohingya here in Bangladesh and also displaced communities all around the world will continue to need humanitarian support.
If I'm not mistaken, UN's humanitarian fund for Yemen dropped dramatically to $800 million from last year's $2.6 billion. Which means 31 out of 41 crucial programs will shut down. So how will this impact this poor nation, and will the international community fail Yemen again?
Well, I'm not working in Yemen. It's a little difficult for me to comment, but I am aware that the funding shortfall is extraordinary, and that will have an impact on the ground, and that impact will be translated into the lives of people who need to be helped but won't receive the help they need. I can say that here in Bangladesh, over the past 2 years, since the beginning of the crisis, we've been well-funded. Well-funded means 70% of the total needs the last couple of years have been met. We hope that we'll receive that same level of funding in 2020, although it's also important to note that our actual needs are increasing with the coronavirus, as we have to create new healthcare facilities, put new teams on the ground, and step up our response.
So under these circumstances, in particular for Rohingya Muslims, which sustainable development goals are viable and matter the most to attain sustainable aid, maybe?
Well, I think all the sustainable development goals are important to displaced persons. That's actually the argument that we make, is it's so important for displaced populations and refugees to be mainstreamed within government responses to the sustainable development goals. So this is really what we try to do to shape our response to make sure that we are part of national efforts to achieve the SDGs.
So what would be the consequences if these people are continued to be ignored, as we've seen for the last couple of years?
Yeah, well, I would say that I wouldn't say that the Rohingya refugees have been ignored. I would say that they received tremendous international support, but the thing they want more than anything else is to return to their country, Myanmar. So finding peace in Myanmar, creating the conditions for them to go home, to enjoy basic rights upon return. This is what's really needed. And of course, it's important for Bangladesh because it is a very, very important responsibility. I think Turkey has borne a huge responsibility for the Syrian refugees over the past few years. It's the same here in Bangladesh. And the Bangladeshi people have been very hospitable. But the Rohingya themselves will tell you that they want to go home, and they can see Myanmar. They can see their place they came from in the distance in the hills of Myanmar, and that's where they would like to go back. But of course, only when it's safe to do so. You're seeing the tragic pictures of the flight in August 2017 as people left from Myanmar fleeing for their lives. And they have found stability. They found relative peace in the camps in Bangladesh, but it's not a future for them to stay in refugee camps. The future must be for them to go home and rebuild their lives in Myanmar.
Do you believe that international pressure is being exerted on Myanmar to repatriate its citizens?
Well, there is quite a lot going on. I can just talk about UNHCR. We have an office in Mongdao. This is the area of return. Over there, we work with the United Nations Development Program and the government on projects in the villages where these people, who are refugees today in Bangladesh, came from, to try to rebuild the community relationships, to try to do quick impact projects to make it possible for people to go back. But fundamentally, it's a political issue. It's a political issue and an issue of governance within Myanmar, and that's going to take some time to solve.
All right, Stephen, thank you very much for joining us on Straight Talk. I appreciate it a lot.
Thank you very much, and have a good Bayram.